Hi, welcome to another Prehab rehab session with Dr. O, naturopathic doctor. I want to go over some exercises to help with wrist mobility and pain and ankle mobility and pain. Because as we're doing lots of jumping and pushing and pressing, things start to get a little bit sore, especially if you've had something going on before the challenge. So the first exercise is to just go through an active range of motion. So with the wrists, just circles. So I want you to do 5, and then switch directions for 5. And whatever it looks like for you. And then give them a little shake. And then you're going to follow that up. It's hard to do an extension by yourself, but I want you to think about just finding some length between the bones here and your wrist. And it's like you're just going to lift your hand up and lift your hand up. And then push down and push down. And give them a little shake. To stretch your wrists, we're going to do it in a few different directions. So we're going to start fingers straight up and down. Fingers down here and reach forward. Now if your wrists are okay with this, great. If you're feeling like it's too much, just do one at a time. Okay? So I'm going to do this arm. I'm going to put it here. I'm going to bring it forward. I could also be on something elevated. And then take the hands out to the side. And then inside. If there's any pain, you need to back off and find a different range of motion. For each of these stretches, you want to hold them for about 30 seconds to a minute. So 30 seconds to a minute here, 30 seconds to a minute here, 30 seconds to a minute here. Then we're going to flip it around. So coming right beside the body. This is more of a stretch up in here. And then take it out to the side. So fingertips reaching away from the body, 30 seconds to a minute. Just play with, can I get back a little bit further? Do I want to bring my hands in front? That's a little intense for me, so I'm going to back it off again. And that's good. And then turn in. This one's pretty awkward. I'll take my knees out to the side. And I'm just going to do one arm. So I'm here, knees out to the side, fingers turned in, so my pinky finger is kind of going this way. Bring it down and stretch. If you have pain in here, you can try taking it up. Seeing if that helps. But just don't go as deep, right? The heel of the hand doesn't have to go all the way down. After you've done all of those, give them a well-deserved little shake and another roll. Now we're going to do it a couple of times here. Now the back of my hands are down and the palms are up. Again, this is a pretty intense stretch. So you can see for me, this arm is in pretty good shape and this arm is not, and I can't get this one down. to stretch it and take care of it a little bit more. So again, 30 seconds per minute there, and then give it a little turn, and then out. 30 seconds to a minute here, and then in. This one again, you won't get as far down, and that's okay. If you're finding this is getting into your back because you're kind of bending over, of course we have the elevated option. Right? And so you could be standing at a table as well, right, and having one hand down and here. And that could be true for all of these ones with the palms down, and then any of the variations with the palm up. Grab our hands, interlace them, and give them a nice roll. And roll. And shake. After doing all that mobility for the wrist, I now just want to pay attention to the muscle groups that are really important in all of the movements that we do through the wrist. So we've got two different groups. We've got one group that are the extensors, and they pull the hand back, and so we want to get up in there. This is that same cross friction massage that I went over in the daily challenge. So just find a sore muscle and pop your thumb back and forth, and then do the same on the inside. So this is our flexor group right here, and then do the same over here. So give yourself about a minute, 2 minutes at least of this. If you have some kind of like a muscle cream that you like to use, you can put that on first. An oil, essential oils, things like that. But you don't need a lot, right? We don't want it slippery. And inside. Now that we've done a lot of stretching, I want you to just actively bring your wrists up as high as you can, and to the side, and down, and to the side, and back up again. And so it's exactly like those circles in the beginning, but a little more intentional, and really trying to open it up. And then switch directions to the inside, to the side, and back up. Good. Give it a little shake. And then this is one of my favorites. Grab your thumb inside your hand, and then push. You'll feel right through here. Our thumbs work very hard, so we want to stretch this out for a good minute. And when you're done, give it a little shake. Okay, so now we'll move on to our ankles. So first I just want you to do that same kind of rotation through the ankles. So we'll do 5 in one direction, 5 in the other. So you can just leave them on the floor. I like to put mine in the air though. I just feel like it feels better. I've got more room to move. I don't have to worry about my heels hitting the floor. So 5 in one direction, 5 in the other. And again, you can be on the floor if you prefer, but if you can take your legs up, that's even better in my books. Point the toes, lots of intention here. Point your toes really, really long, and then flex, 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 flex back. Point, 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 point. Flex, 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 flex. So we're gonna do this one 10 times. When you're done your 10 dorsiflexion and plantar flexion, come on up to a seat. And instead of moving the foot this way, we're gonna go and twist. Okay, so this is called pronation and supination. So in pronation, the insides of the feet are turning away from each other. So it's like the big toes are coming in, the backs of my feet are trying to face each other, and the baby toes are reaching back. And so this is all active, right? You're actively trying to use the muscles in your legs and your feet to do this. And then they twist towards each other. And towards, and again do this 10 times. So 10 each. 1, 1. And when you're done the 10, give them a little release. And even shake the legs. Now I'm going to get you to stretch out your calves because they are so related to what's going on in our ankles and our feet, as well as the front of the leg right through here. Okay, so 2 different muscles in the calf. We've got the gastrocnemius, kind of the bigger one that you think of when you think of a calf. We need to stretch that out with a straight leg, and then the soleus runs a little bit deeper. You don't really see it. You kind of see it bulge out the sides, and that needs to be stretched with a bent leg. So it can be done just like this, bent knee, driving the knee down, and feeling that stretch kind of deep down in the calf, kind of right in here. And then hold it for about a minute, and then straighten the leg out and do it here, and hold that for a minute. If this isn't really getting into it for you, you want to switch it up, you can do like in the mobility session. Instead of working as an ankle mobility though, I really do want you to feel the stretch through the calf. So don't worry about the angle in your ankle so much as leaning forward through the body to get the stretch through the back of the calf. So this is with a straight leg. So I'm stretching my gastrocnemius. When I bend the knee, it's a little more awkward. You have to bend the knee and then lean forward. Usually I have my hands against a wall. My wall's a little in here. It's harder to get. Hold them for 1 minute each and do on both legs. Okay. So for myself, I find the gastrocnemius I can do better against a wall or whatever surface you've got here. And the soleus, I do feel I get into it a little better in this kind of funny lunge position. One minute each exercise per side. I find stretching in here very difficult. You can kind of pull the foot away, but I find it never really gets in there how I want it to. So what I want you to do instead of worrying about stretching is to do some skin rolling. Okay, so you grab your skin and you pinch all the way down. And then all the way back up. It's pinchy. It kind of hurts. But it's going to release adhesions between your skin and your fascia and your muscle, which we tend to get a lot of right here. And just kind of pinching the skin and then sliding down, and then pinching in and sliding down, pinching in and sliding down. About 3 to 5 times up and down. And then make it feel better. Little effort. And to finish off, we'll do an ankle mobilization. So we're in this kind of crouch position, keeping the heel quite close here and pushing forward. So we should feel this has a little bit of a stretch through the back of the leg, but more than that, we really want to be working on this ankle mobility and closing the ankle, getting the shin closer to the foot and pushing the body weight forward. You want to hold this for about 1 to 2 minutes if you can per leg. Often at the gym, I take a kettlebell and put it on my knee to kind of bring it forward. And feel free to kind of rock it forward a bit and bring it back a bit. One to 2 minutes per leg. All right, so after all of that, just give everything a nice little roll forward and back. And I hope your wrists and ankles feel great.